Sports medicine is kind of the overarching term given to a number of fields that have to deal with treating active and athletic populations for any sort of things, whether they're physical injuries or illness, and also dealing with mental health as well. So our faculty within the program incorporate their experiences in many different ways, explaining different cases or different patients or people that they have worked with in the past and using that to frame a injury or illness that's being talked about in class, and then also allowing our students to go and see how different clinicians work within those different fields out in the practicum type experiences. An ideal student for our sports medicine program would be one that is open to collaboration between different professions, students that want to be challenged, and students that are eager and ready to learn to become a better healthcare provider for their patients. Our Master's in Science and Sports Medicine program integrates with the Doctorate of Chiropractic program here at University of Western States very closely. The students will take anywhere between 5 and 7 credits alongside their chiropractic courses to be able to get the sports medicine skills and knowledge alongside their chiropractic skills. The students are also able to take their knowledge that they're learning in the DC program and then apply it in sports medicine, and then eventually apply it into the practicum experience as well. A prospective student should look to enroll within the program to be able to really become a better clinician, to be able to provide better care for their patients and clients, and have a better, deeper understanding of sports medicine and care for people that are active or athletic.